your eyes? That's because it'll glue your skin together in seconds. Now doctors are putting that very characteristic of crazy glue to use, replacing stitches. It'll happen millions of times a year, especially during holiday weekends. Someone suffers some kind of cut or laceration that'll take stitches to close. And no one, kids or adults, likes stitches. But what if you could use something like this, glue to close the wound instead of stitches? It's called Dermabond, a medical-grade cousin of crazy glue.
Any cut, any incision that you have, if there is no tension on it, you can apply the Dermabond, the glue, any part of the body. Wherever you have a skin that you close, on the face, on any part of the body, on the lower part of the body, breast, abdomen, you can use them. So the rest is?
One spot where the glue is very useful is for cosmetic procedures, such as eyelid surgery. That's what Carol Powell is about to have.
I want to go to work in a couple of days instead of taking weeks off for possible, swelling, I think, from stitching. I'm hoping that this will be less.
Dr. Asadi says that stitches do yield excellent results in the eyelids, but that patients can sometimes feel them, or they have to be taken out. Plus, stitches can cause whiteheads to form in the skin. So Dermabond is ideal here. Just hold the skin edges together, apply a light coat of glue, wait a few seconds, and that's it.
There is no difference between the scars as far as the final results are concerned, except that you are just getting those annoying parts of the suture removal and all those things that we mentioned before out of the way.
The glue came off on its own after a few days, and it was wonderful, and it seems to be holding up great.
Now, this doesn't work very well if there's a lot of tension on the skin edges. You'll need dissolvable stitches underneath the skin there, and the glue can then be used on the surface. I know some doctors who have even started carrying Dermabond in their first aid kit so they can close a laceration in places where stitching is impossible. And, of course, with families on vacations and things like that, people get cuts all the time.
Good thing to have. Yeah. All right, Dr. Matt, thank you.
That's going to do it for Live at 5. Thanks for